The forthcoming government consultation on England's men's health strategy, while a step in the right direction, is long overdue, and its timing could not be more urgent. The issue of men's health has been largely ignored for decades, and this new initiative underscores the profound neglect of male-specific health needs, especially in light of the shocking statistics that reveal men's significantly lower life expectancy compared to women. Men are not only more likely to die prematurely from diseases such as heart disease, lung cancer, and liver disease, but they are also far more likely to suffer from mental health crises and commit suicide, with men accounting for 3/4 of all suicide cases. The causes of poor men's health are multifaceted and cannot simply be chalked up to lifestyle choices. Though it is true that men are statistically more likely to engage in risk-taking behaviors such as smoking, drinking, and drug use, there are deeper, systemic issues at play. One of the critical factors contributing to this trend is the societal expectations placed on men. The pervasive cultural norm that men must be strong, resilient, and self-sufficient leads many to avoid seeking help, even when they desperately need it. This man-up mentality can have disastrous consequences, encouraging men to ignore early warning signs of health problems or avoid medical attention altogether. Additionally, the societal pressures surrounding masculinity often translate into a reluctance to engage with health services. Men, especially those from disadvantaged communities, often do not possess the necessary health literacy to recognize symptoms or take action to seek care. The story of a young man climbing a drainpipe to avoid asking for condoms at a clinic exemplifies this issue. Men are simply not equipped with the skills or confidence to seek help when they need it most. This lack of engagement with health services is compounded by the fact that, unlike women, men do not have regular touchpoints with healthcare systems, such as those provided by contraception, cervical screening, or childbirth. The situation is made even more dire by the stark differences in health outcomes between the wealthiest and poorest communities. Men living in the most deprived areas are not only more likely to die earlier, but also face significant barriers to accessing healthcare. The disparity in life expectancy between the wealthiest and poorest areas is 10 years for men, a gap larger than that seen among women. This gap is particularly concerning when considering the fact that men in blue-collar jobs, such as construction or manufacturing, often face logistical challenges in attending health appointments. Job insecurity, financial stress, and concerns about job loss due to illness further discourage many men from seeking medical help, exacerbating the cycle of neglect and poor health outcomes. Moreover, this issue is compounded by the underutilization of services such as NHS health checks, which are designed to detect early signs of chronic diseases. Fewer than 4 in 10 men take advantage of these checks, indicating a broader problem of disengagement with preventative care. As Mark Brooks, policy advisor for the All-Party Parliamentary Group on Men's and Boys' Issues, highlights, the current healthcare system simply does not cater to the needs of men, particularly those in manual labor sectors. Men working in these environments are often unable or unwilling to take time off for health appointments, either due to job pressures or a reluctance to confront health issues head-on. The stigma surrounding mental health is another critical issue, as men are more likely to express signs of depression through anger, substance abuse, or withdrawal, rather than the more traditional symptoms recognized by health professionals. This disparity in how mental health issues manifest can make it difficult for healthcare providers to identify and treat these conditions in men effectively. Furthermore, the lack of mental health services designed specifically for men exacerbates the problem, as only 1/3 of those referred to talking therapies are men. This shows a fundamental failure of the healthcare system to address the unique ways in which men experience and cope with mental health challenges. Despite the grim picture painted by these statistics, there is some hope that the men's health strategy will shine a spotlight on these issues and inspire real change. However, it is crucial that this strategy not only provides a framework for better healthcare access, but also tackles the root causes of male disengagement with health services. Men need to be equipped with the skills and confidence to recognize the importance of regular health checks, seek help when necessary, and engage in preventative care. This shift in behavior will require a cultural change, which, as Professor Alan White suggests, should begin with a national awakening among men themselves. There is no denying that significant progress needs to be made, and the upcoming consultation must be a turning point in how the UK addresses men's health. While initiatives like the Movember campaign and local men's groups such as the Men's Sheds movement are helping to engage men in health conversations, they remain scattered and limited in scope. To truly address the systemic issues surrounding men's health, the government must ensure that the new strategy not only includes accessible healthcare options, but also provides targeted support for those in blue-collar and deprived communities. It is essential to tailor healthcare services to meet the specific needs of men in these groups, whether through better access to health checks or providing more flexible options for healthcare appointments. If the government's new strategy can address these challenges, it will mark a critical first step in improving men's health outcomes. However, it will require ongoing commitment and significant changes in both healthcare policy and societal attitudes toward masculinity and health. Only then can we begin to reverse the deeply entrenched patterns of poor health that have left so many men at risk of premature death and long-term suffering.